Let's continue with Gallbladder 36, another Shea cleft point. This is located 7-tune proximal to the highest prominence of the lateral malleolus on the anterior border of the fibula. Needling vertically 0.5 to 1.5 tune. Using the spreading hands technique, we locate GB35 at the midpoint of a line connecting GB34 in the depression anterior and inferior to the head of the fibula, and the highest prominence on the lateral malleolus on the anterior border of the fibula, distance of 14 tune. GB36 is located 7 tune, proximal to the prominence of the lateral malleolus, or using the spreading hands technique, we locate GB36 1 tune distal to the midpoint of a line connecting the popliteal crease and the highest prominence of the lateral malleolus on the anterior border of the fibula, distance of 16 tune. For orientation, the borders of the fibula are deep to the peroneus brevis muscle and are often not easily palpable. For this reason, it is suggested to palpate the anterior border of the fibula just superior to the ankle and then locate the point on an imaginary line running to the head of the fibula. Located on the same level are GB35 on the posterior border of the fibula and bladder 58, 7-tune proximal to bladder 60. The invigorating nature of Shea cleft accumulation points affect the mind positively, clearing and stimulating thought, bringing clarity and a fresh perspective. Qi and blood gather at Shea cleft points. They are particularly energizing for the meridian on which they are found. Shea cleft points are used in acute conditions to move obstructed Qi along the meridian. The potential of this Shea cleft point on the gallbladder meridian can give strength and fluidity to those who feel insubstantial and timid, or inflexible and rule-bound. As with many points on the calf, the name of this point is a reference to its location on a hill of flesh, the calf. As the Shea cleft accumulation point, GB36 or outer mount can be used in cases of obstruction or pain of the meridian or fu, and as a distal point to influence the other end of the meridian, neck pain and stiffness, chest and hypochondriac fullness and pains. GB36 is for acute leg pain and paralysis or spasms of the ankle or calf. Consider where there is a strong dislike of the wind and cold. This point can help to bring clarity and perspective in a person's life.